Welcome everybody to the Tecan workshop. My name is Sylvia Becher. I'm working at RECIPE in Munich, and RECIPE provides LC and LC-MS Complete Kits for using clinical diagnostics. And today I would like to present you our automated LC-MS methods for the clinical diagnostics, and especially I will present you the automated methods which we realized for the TDM and for vitamins. Oops. In the beginning, a short outline. At first, I will give you some general information concerning automation, and then I will present you the automated LC-MS methods for using clinical diagnostics. And there, as I said, for TDM, I will present you our LC-MS Complete Kit for the immunosuppressants in whole blood. And for the vitamins, I give you information about the 25-hydroxyvitamin D2 and D3 kit in plasma and serum. And yeah, in the end, a short conclusion. Here you can see a typical LC-MS experimental workflow, where you have a sample preparation step, a chromatographic step, and yeah, you have your mass spec, and in the end you have data evaluation and interpretation. And the bottleneck, as I said, Maria, is in most methods the sample preparation step here. And this sample preparation step is often done manually. And with this sample preparation step, you have, can say, a reduced laboratory throughput. But throughput is not the only issue. If you think of the hand-on time and sample traceability and the process efficiency. And so, for an automated LC-MS workflow, you have to focus on the sample preparation step. And the aim of an automated LC-MS workflow is a fully automated LC-MS front-end module. So you, with this front-end module, you can significantly reduce your manual workload and increase the sample throughput, of course, and also the sample traceability and reliability of results, which is quite important. And this automation of the sample preparation step is realized with a liquid handling system, and there are many providers of this liquid handling systems. These are all open systems with a flexible configuration. You have a barcode scanner and all what you want. Yeah. So let's have a look to our LC-MS Complete Kits, which were automated for the TDM and vitamins especially. So we have the immunosuppressants in whole blood, which is a quite important parameter, and for the reliable TDM of cyclosporine A, tacrolimus, sirolimus, and everolimus, we developed this automated LC-MS Complete Kit. And further, we have the 25-hydroxyvitamin D2 and D3 in plasma and serum. Also, this LC-MS Complete Kit allows sensitive and specific diagnostic of these analyte in plasma and serum. Okay, both complete kits include matrix-based calibrators. These are multi-level calibrators. Both are lyophilized. The one for immunosuppressants, of course, is based on whole blood. The other is based on serum. And this kit also includes controls based on the same matrix, whole blood and serum, respectively. Also multi-level controls. So let's have a short look to the analytical procedure of both kits, which have the same principle. In the beginning, you have a prior sample preparation step, where you add your internal standard, and reduce sample matrix, but it's more or less a protein precipitation step. This is done in the beginning manually. After this step, you inject your sample to the LC-MS system, and for both kits, we have a two-dimensional LC system with an additional sample cleanup step in the first dimension with an online SPE in the trapping column, and the analyte separation is done in the second dimension. After chromatographic separation, of course, the analytes are ionized using electrospray ionization for the immunosuppressant kit, and APCI is used for vitamin D. Yeah, and mass analyzation and detection, of course, with a triple quad with the scan mode MRM. And yes, as you can see, most of the steps are automated, but we have a one manual sample preparation step here in the beginning. But this can be automated, and we automated it already. But let's have a look at first to the manual sample preparation step. You have your sample, calibrator control patient, which you mix with a precipitant, which includes the internal standard. Then you have to incubate it, mix it again, and you have to centrifuge it. Afterwards, you inject 10 to 50 microliter of the supernatant. But when we try to automate it, we have to use a liquid handling system, and in our lab we have a Freedom EVO, which you can see here, with all necessary compartments which you have to have for this analysis. Of course, a liquid handling arm, barcode reader, and shaker, plate carrier, and so on. And yes, now let's have a look on the automated workflow. Of course, in the beginning you have to place your samples, calibrators, and consumables on the deck of the pipetting system. This is manual step, but all further steps are automated. After you started your system, the sample barcodes are scanned, the precipitant is pipetted into the vase, your samples are added, the extraction plate is shaken, then during this time the balance plate is pipetted for the centrifugation step. Then the extraction plate has to be shaken again for a short time, and then you have to centrifuge it, and in the end the samples are transferred from the extraction plate to the injection plate. And yes, in the end a data file is created, which includes the barcodes and the vial position. And in the end, of course, you have to seal the plate, and you have to place it in the autosampler, which is, of course, a manual step. But as you can see, the most of the steps are automated, and with this workflow, 96 samples can be prepared within 45 minutes. Okay, when you inject your sample to the LC-MS system, we have a two-dimensional system, and you have to have 2 isocratic pumps for this two-dimensional system and a 6-port switching valve. And the total runtime for the immunosuppressant whole blood kit is 2 minutes, while 3 minutes are for the 25-hydroxyvitamin D2 and D3 in serum. Here you can see the chromatograms, or on the left-hand side, the chromatogram for the immunosuppressants in whole blood kit. That's a whole blood calibrator with level 4, so medium concentration level. And on the right-hand side, you can see a chromatogram of the 25-hydroxyvitamin D. Also calibrator with a lower level. Okay, so let's check the method performance of both kits. First of all, of the immunosuppressant whole blood kit. Especially the linearity and precision and accuracy data are presented here. And we have very good results for linearity. Also intra and interday precision are below 9.2%. And also the accuracy results are very, very good. Then here you have the results for the 25-hydroxyvitamin D2 and D3 in serum and plasma. Also a very good linearity, and very, very good intra and interday precision results with a CV of below 4.9% for both analytes. Accuracy data were performed with the standard reference material from NIST, and also here a very good bias could be observed. Then we compared the method with manual sample preparation with the automated sample preparation, and as you can see here, for the automated immunosuppressant kit, very good agreement could be obtained for clinical samples. And this was also the case for the immunosuppressant kit. Okay, so let's conclude. We developed an automated LC-MS Complete Kit for the immunosuppressants and vitamin D. And with this complete kits, highly specific and reliable LC-MS is possible. And with our multi-level calibrators, an accurate and precise quantification can be reached, and we have our quality controls for the quality control, of course. And matrix effects are compensated with an internal standard. And we have to say that a fully automated front-end module could be obtained using a liquid handling system and a two-dimensional LC-MS, where 96 samples can be prepared within 45 minutes, which significantly reduce the manual workload and, of course, increase the sample throughput and increase the sample traceability and reliability of the results. Okay, I thank you very much for your attention, and I think you have questions.